everyone. Good afternoon, good morning, and good evening to all of those tuning in and all of those listening to us afterwards. My name is Lina Badr. I'm the FIP lead for Workforce Transformation and Development. I'm also the lead for the COVID-19 online program. It is my pleasure to be here and joined again by my esteemed panelists from our event in June. And very, very happy to be picking up where we left off, continuing this really important conversation and answering some of your very important questions that you have sent us through. Just to tell you a little bit more about the topic and a reminder really of where we are with this issue. As the coronavirus pandemic claims hundreds of thousands of lives across the globe, a parallel crisis of substandard and falsified medical products claiming to prevent, treat, detect, and even cure COVID-19 threatens to add to the growing death toll. Currently, with no safe and effective vaccine available yet, a vast window of opportunity has opened for criminals to exploit fearful populations by selling fake coronavirus medicines, test kits, disinfectants, masks, and many other medical products for significant profit. Drug shortages caused by the crisis have also created ideal conditions for SF or substandard and falsified medical products to fill the gap both online and offline. In our last FIP digital event with my panelists today, on June 18, we explored the SF issue through 5 perspectives: the illicit sale of medicines online, a country experience in Africa of frontline pharmacy from Rwanda, the role of education, training, and advocacy, the role of pharmaceutical industry in the fight, and the role of youth leadership. So really, we've explored it through a number of dimensions. And in this follow-up, in part 2, we continue the discussion with our panelists and dedicate this to address the many questions and comments we received from our June 18 participants and attendees. So we thank those in advance for helping us guide the discussion today. And we welcome further questions from the audience listening to us today. We'll move to introductions very quickly, although hopefully everybody knows our panelists by now. They have become famous, and our initial event has been extremely successful and really popular and has called for this follow-up. But we'll start with mini introductions, and I'll ask each one to please briefly introduce yourself and remind us of the key points you have shared with us in the first event. We'll start with Mariam. Mariam, welcome today, and thank you for being with us today.
Thank you for having me. It's lovely to be here again and to address the questions from last time. So I'm Mariam. I am from the University College London School of Pharmacy, and we have a UCL Fight the Fakes team there. So I am a co-student lead of that team. As of this week, I'm a pre-registration pharmacist at Bart's NHS Trust. So I've been working here to complete my training. So last time, just to recap, I talked about youth leadership in fighting SF medicines and how young people can take a lead on this issue.
Thank you, Mariam. I'm looking forward to further exploring these points with you today via some questions as well. We'll move on to Oksana. Oksana, thank you for being with us again today. Really appreciate it.
Pleasure to be here, and hello to all of our attendees online. Thank you for joining us again to carry on this very important discussion. So I am a senior teaching fellow and global engagement lead at the UCL School of Pharmacy and board trustee of the Commonwealth Pharmacists Association. And we also have a fellow colleague on the panel from the CPA who will be joining us today. And I've created the academic chapter UCL Fight the Fakes, really to help address the educational gap. There's a significant need for pharmacy students and practitioners to learn more about medicine's quality, as well as driving research and supporting youth-led advocacy and influencing policy globally.
Thank you for that, Oksana. And Stan, hi again, Stan. Really, really great to have you with us today. Please tell us again who you are very quickly and remind us of what you very helpfully told us last time.
Thank you, Lina, and good afternoon, everyone. I'm Stanislas Barrow, the Global Head of Anti-Counterfeiting at Novartis. During part 1, you may recall that I had the occasion to present to you the private sector perspective, and particularly Novartis, what it is we were doing against falsified medicines. In terms of governance, remember a program supported by 15 functions, governed by the executive committee of Novartis, against 4 pillars: intelligence, prevention, enforcement, and stakeholder engagement. And I'll be more than happy to answer your questions in a few minutes. Thank you very much.
Thank you, Stan. And moving on to Mike. Hi, Mike. Thank you for being with us again today.
Good. Thank you very much. A pleasure to be part of this this second webinar. Thank you for putting it on. I represent the Alliance for Safe Online Pharmacy across Europe, ASOP EU. And our goal, if you like, is to make the internet a safer place to buy medicines where it is legal to do so. We very much work on solutions. And so, for instance, I'll talk about this a bit later on, but the Digital Services Act is all about hopefully providing laws and legislation that will actually make the internet a more governed place. Other solutions like .pharmacy, if you go to a pharmacy with that website address, it will be authentic. And of course, we believe that raising public awareness is paramount, because after all, it's you and I that are creating the demand online. Thank you.
Thank you very much, Mike. And last but not least, we have with us Flandry down the line. Flandry sadly couldn't join us via video, so we're missing out on seeing him, but we do have him down the line and we're really grateful. Flandry, thank you for joining us today.
Yeah, thank you, Lina. Good afternoon to everyone. So my name is Flandry. I'm a pharmacist, current president of Rwanda Community Pharmacist Union, and I'm working also with a wholesaler pharmacy called the Trust Pharma Lab. So last time we were together talking about how pharmacists are responding as a frontline, how are responding to COVID-19. So I'm ready to respond to your questions. Thank you.
Thank you so much, Flandry. And again, I can't reiterate what a pleasure it is to have all of you again today. And it's great to have such a full house of experts with us. So we will start off with a question for everyone, and then just continue the discussion with some more specialized questions for experts, and then close off with another question for everyone. Just another reminder to all attendees, please send in any questions or comments via chat. We may be sharing some links with you throughout the discussion, and we'll hopefully will be also collating all of these helpful links and sharing them with the recording afterwards. So, beginning with the first question for everybody, there has been a growing number of secret, illegal medical clinics and pharmacies operating all over the Philippines. And I guess this is a question from a colleague in Philippines, but does resonate with other countries. And these clinics and pharmacies have been treating COVID-19 patients and selling SF unregistered pharmaceutical products. What is the best move or moves or measures that we can take to combat this growing problem? So maybe we'll start with Flandry.
Yeah, thank you very much for the question. I may say that everyone, the contribution of everyone is required to combat this COVID, this treatment which is illegal. So, but in the case of Rwanda, I may say that we don't have those cases because our health system is well regulated. Because to be able to work, to be able to have a clinic or retail pharmacy, you should be licensed. To be able to sell any medicine, you should be able licensed. So I think this is a best example that every country should copy to their countries. So to be able to tackle those substandard and the counterfeit medicine. Another thing in Rwanda, we don't not yet getting the guideline for treatment of COVID-19. So there is no specific medicine, as you know, also WHO not yet confirming the best medicine for treating this COVID-19. So it's better. Every country should follow the guideline which is already highlighted by WHO or their health system. So this is how we are handling this, how we are treating the COVID-19 in Rwanda. We are treating based on the symptoms. When patient has cough, when it has is sneezing, when is body breathing. We treat the symptoms because there is no medicines specified for treatment of COVID-19. Thank you.
Thank you, Flandry. And that's a very good point. And I suppose we have to be mindful for the fact that we have been hearing about developments with regards to vaccines. Things have been progressing, hopefully leading to a successful vaccine. We don't know that yet, but this does bring to question the issue of what the implications would be should we have a successful vaccine on this issue. So maybe the same question, but with a twist to Oksana. How can we combat or prevent any arising issues from COVID-19 treatment or prevention measures that will hopefully come to play?
Thank you. Yes, so I think there are really two parts to this question. One is about the criminality of the nature, whether this is related to COVID-19 falsified product or not. So what we really need is a harmonized international approach such that the legal penalties, the punitive measurements actually are strong enough to then not be just a slap in the wrist. We know that it's about $200 billion profit in selling fake medicines worldwide. So it is a big business. And now criminals are set to capitalize on primordial fear that is surrounding this pandemic and make significant profits off of it. We've already had reports from Israel of fake COVID-19 vaccines, and really it is well known at this stage that there is no safe and effective vaccine on the market yet. We did have some positive news earlier on Monday in the Lancet, and we saw the publication of the Oxford trials where an immune response was shown with antibodies and T cells present. However, the earliest that this team in Oxford suggests that their product can be ready would be October. And that's, well, and not for mass distribution, but to complete phase 3 trial. So that's already, that's a best estimate, and many other suggest that that timeline could be significantly longer. However, once a safe vaccine, not just from the Oxford trials, because it's very likely that there are going to be several different types of vaccines that will be available on the market, and that's going to be necessary in order to immunize the populations. However, there will not be the opportunity to treat everyone at once. And because of that, there will be a prioritization system most likely for high-risk people, for people who are in frontline, high-risk jobs such as health workers, etc. So when this gap exists, this is going to be another opportunity for criminals to then enter the market, and it will be actually even easier at this stage because a vaccine will be available to then sell it perhaps online, where other people feel that they can't access it, but they're very concerned about contracting the disease. So we know that disinformation, as well as fear and panic, then drive people to go to some of these unregistered, unlicensed black markets for medicines. And once we do have a medicine in the market, I would actually argue that we will see, and that's when it will become most risky. The other trend we have noticed is that whenever a particular medication related to COVID-19 has received significant media attention, for example, hydroxychloroquine, chloroquine, mentioned by in the press frequently, also by the US president. Then we saw in DRC, as well as in other African countries, over 300 hospitals and pharmacies had falsified products enter their supply chain. And this is published on the WHO website. You can see this through their medical alerts. So there There is the risk again now with dexamethasone, because we have seen that this has a benefit in patients who are severely ill, who are hospitalized. Dexamethasone is a powerful corticosteroid that has anti-inflammatory effects. But there is this link. Once there's greater need for certain medication, if there's shortages, and if people can't access it for whatever reason, whether that's because there's a distribution challenge or others, that's when the conditions, let's say, become perfect for this crime to occur.
Thank you, Oksana. That was really well-rounded and covered a lot of the aspects. And just reminding the audience of the question we're still answering, which is, you know, in the times of COVID-19, there has been a rise of substandard falsified medicines and treatments around the world. And this was a question from a colleague in the Philippines. So what measures can we take to combat this growing problem? So moving on to Stan, maybe, giving us your perspective as an industry expert on this.
Thank you. I mean, the ones on the front line are law enforcement on health authorities whenever they have powers to investigate and enforce as well in the country. So they are the ones on whom we need to rely. On the private sector has a role to play to support them in the authentication process or sharing intelligence and whatnot. So in the context of the Philippines, they should be the first one to really take a stand in relation to the matter. I appreciate in certain countries, there's not necessarily an immediate reaction toward this or some leniency, or there could be a number of explanations. There are corruption in other countries, and so the list could be long. So I think adding a bit of pressure as well on the authorities to take a stand is sometimes helpful. We try to do this at a policy advocacy level. We have engaged with lots of non-governmental organizations to also, raise awareness about the topic of falsified medicines in the context of COVID-19, because there's been an increase as well. Another thing that can be done as well is engaging with WHO, for instance, which is a sort of umbrella organization engaging with all the health authorities across the world, most of them at least, to escalate matters as well. So I did share the link on how to engage with WHO and report incidents, bring that to their attention, because I know if there is a substantial amount of incidents coming from one country, they will definitely reach out to that country and see what's going on. What are we doing about this? So it's a very broad question. So I think we will remain in the broad answer sort of scope, if you wish. There are various ways we could address specific topic, but I would say local enforcement and health authorities are the primary point of contact. International organizations are here to help support and usually add a bit of pressure. WHO, the World Customs Organization, Interpol, they're working on operations. On the private sector, definitely has a role to play. If we are concerned, if our products are concerned, we are here to support for authentication, investigation, on follow-up on the legal means. So I would stop here. Thank you very much.
Thank you for that, Stan, and I'm sure we'll have a chance to expand on these through the other questions. Very helpful. Mike, moving on to you, please let us know from your point of view the most important measures we can take to combat this problem. And this is a very big question, lots of answers, but we try and keep it as brief as possible for now.
I think, to be honest, I think the previous two speakers have answered it very cogently. What I would add, though, is the power of the media. And interestingly, the House of Commons in England, in the UK, just published a 47-page committee document. And what is interesting is the following. In contrast, and I'll read, in contrast to the lack and loss of trust in social media as source of news, evidence has showed that people have turned increasingly to public service broadcasts. In the week of the 23rd of March, for instance, BBC TV network news reached 44 million people, the highest number since the 2003 Iraq war. From a Filipino point of view, I think it's absolutely essential that you get journalists interested in this. And whilst government pronouncements do sometimes meet with some skepticism by the public, if there is an independent broadcasting mechanism within your country, and I'm sure there is one in the Philippines, that to me has got to be conjoined with what Stan and Oksana have said about law enforcement, health authorities taking the lead. So the health minister in the Philippines needs to publicly announce that there is a problem here, and therefore the public will hopefully be educated more about the problem.
Thank you for that, Mike. Really good points to add with a different dimension from that side. Last but not least with this question, and then we'll move to more specialized questions to the panelists. Mariam, what are your views on this in terms of tackling this issue in the times of COVID?
Okay, so I would say do whatever you can in your capacity to raise awareness of this issue. That's like the single best thing we can do as well as young people. The fact that you're aware of this issue in the Philippines may not mean that others are too. So just, call this out. So reporting pathways are there, and I think the experts on the panel, better explained it. And you can follow them up to know the specific sort of, how to escalate this. But also I think just raise awareness and educate others on this. The public needs to be aware that this is an issue so that they are more alert, but then also don't be afraid to sort of nudge your local regulators to take an action, and because this can ultimately come back to our pharmacists who are on the front line, who can then locally support their communities. So I think most of the panelists have better addressed this question, but so I completely agree with them.
Thank you, Mariam, for reminding us that actually voicing the issue is the first step towards solving a problem. And this is a very, very good point. I have a question for Stan, and we've received a lot of these questions about practical ways of actually, from pharmacists on dealing with this issue. And we've had a question saying, how can countries that don't have the capacity for the laboratory equipment and technology detect counterfeit medicines and track it without the ideal set of resources?
Thank you, Lina. Personally, I see it as the biggest challenge we have today on combating falsified medicines. Localization of authentication means and resources to timely detect. That's problem number one in my view. So there is a sort of immediate term on medium long-term view on this. At short notice, the private sector, for most of them really, are here to support and have means to support the authentication. But the challenges here is that, samples collected have to be sent to a place where they can be analyzed. So we can support with that, but it takes time, unfortunately, and it still does take, in most occasions, too long, to be honest. But that's a reality of the situation until countries at a Ministry of Health level are fully equipped with their own authentication means as well to accelerate the process. There is no perfect solution for that. So there are just maybe some common sense recommendation. First of all, everything that is outside the regulated, legitimate supply chain should be taken out. What it is exactly, well, we don't know. We could analyze later on, but it's illegally sold, and that should be addressed. It could be stolen, it could be tampered, it could be counterfeit. Various implications for patient safety, not all as dramatic, but it doesn't matter if it's illegal, it's illegal. At the end of the day, we should take it away as a precaution. So there could be a lot of work being done on this without necessarily going through forensic authentication. Then still, at the end of the day, in most countries, there are means. They are not big. There are not many places in the countries where you could analyze samples, but let's be realistic, in the vast majority of the countries, there is at least a place or two where that could take place as well. But things take time, so we appreciate that. On the longer run, what we're trying to develop and work from the private sector, but we work a lot with the public sector on this, are technologies we could localize, bring to the countries for fairly quick authentication of falsified medicines as well. It's not easily done. It's going to take a while. We're probably talking about a couple of years from now. We're exploring different technologies, mobile enabled, cloud-based, that are very interesting. There's been a lot of progress in that field, and we've made a huge amount of progress in just about a year now, but that's going to take a little while to implement. But that would be the biggest challenge for us to tackle, to have local detection technologies to accelerate on this. Apologies, not a perfect answer. There is no perfect one. It's still one of the biggest problems we're faced with. So just wanted to brush through a couple of options. But if in doubt, people could always reach out to, first of all, the Ministry of Health in their respective country, or if a product is clearly identified, let's say a Novartis branded product, approach us. Could be social media. We have an email address I could share for approaching us, and we can help directly on that. That's what I can suggest for now.
Thank you, Stan. It's no perfect question, but it certainly is practical. It's about doing with what we have, and I think that's been very helpful set of tools and tactics for individuals in this situation. We're moving on to another question, and I'll actually get both of views of Mike and Oksana on this. And I know the focus of our discussion initially, last time especially, and through the examples set by Flandry from Rwanda, we did focus on community pharmacy, but we did get some questions on actually hospital pharmacy practice and how we can mitigate the impact of SF medicines on COVID-19 in hospital from the perspective of hospital pharmacy practice and sector. Oksana, perhaps we'll start with you and then move on to Mike to hear his views as well.
Yes, so for hospital pharmacy practice, I think there are really 3 points that we could focus on. So for falsified medical products themselves, a robust track and trace system with the unique 2D barcode identifier, so the FMD, which is now implemented across Europe, is one way of tackling it. And of course, we can't lift that particular solution and implement it elsewhere, but even just ensuring in the areas that it is being used, that it's being used efficiently, and that it's being used appropriately, that these governments are mandating its use, and that robotics can be actually a real tool to help support with scanning and ensuring that there are efficiencies within that system. When we look at the substandard, which is of course a separate part of the puzzle, you need good storage procedures, because a lot of medicines may be absolutely fine when they're made by the manufacturers and through the chain when it goes through wholesalers as well. But if they're not stored appropriately, if they're exposed to heat and light and they can degrade, then we see that those practices need to be regularly examined, audited, and updated. Third, I would say, is actually where the pharmacist kicks in, and that we start to also think about looking at medicines reconciliation or medicines review, where we discuss with patients where they might get their medicines, whether they use online sources, which are legal and can be fine, but just to really ensure that they have the health literacy around identifying legal pharmacies, etc. And if they're taking vitamins and supplements, equally then where they are coming from. So in that capacity as a healthcare professional, there is the opportunity for the pharmacist to actually discuss this substandard and falsified medicines issue, which is not currently normalized. I think this is a big opportunity to add that into best practice. And I'm sure that Mike will be able to also add on to some of the thoughts and details, particularly around the FMD.
Thank you, Oksana. Mike, we'd love to hear your views on this.
To be honest, I don't have a great deal to add. My notes I have here are I think Oksana's really covered it very well. I mean, clearly, where you have a hospital that is sophisticated. I visited the Geneva hospital. They have linked the Falsified Medicines Directive robotics, so your pack goes onto a conveyor belt. it's automatically sorted and then put robotically away. That's the ultimate best practice, and then that's joined to the IT system within the hospital to reduce and track and trace, so there is minimal medication errors involved. I think the major comment, though, is that where you have a hospital that does not have that kind of equipment and systems, then for me, the question is really about the pharmacist and the procurement pharmacist, if that exists within the hospital. And it's a bit cliched, I know, but it's going to a trusted source. You will have built up experience of where to buy your medicines for that hospital. And in my opinion, there is no better way to circumvent the problem of falsified medicines by going to a wholesaler that you know, that you trust, that has good links to the manufacturers, and where are those manufacturers based. So, you know, they have proper certificates of analysis when the medicines are imported to that country. And these are the kind of checks that I think pharmacists should perhaps go up the line to check and double check where the medicines are coming from. And then from time to time, as Stan has mentioned, to do perhaps a random audit on certain medicines that are very common, that might reveal problems. But for me, the local person on the ground going to a trusted source is the best possible way to circumvent a counterfeit problem. Thank you.
Thank you for that, Mike. Really helpful. We move on to another question that we've received, and I know Mike has extensively covered the issue of combating illegal sales of through online pharmacies and online. That links to that, and maybe we'll start with Mariam on this. Mariam, we received a question asking how can we fight selling substandard falsified medicines on Facebook and other social media outlets. What are your views on this, Mariam? And I invite Mike to add anything onto this as he wishes.
Yeah, so with regards to Facebook, and I'll generalize to all social media, this is in fact an excellent tool to raise awareness, and I'm sure everyone will agree on the panel here. I have to mention UCL Fight the Fakes here. So examples of how we have been using social media to really raise awareness, and then hopefully people in the audience can sort of take that, support that, and also, you know, use some of these ideas and do them in their own countries. So I think that's the best way to tackle this question. So the team has been, our UCL Fight the Fakes team has been working so hard from home to deliver Instagram live sessions, using Facebook Lives too, and to interview key people and organizations so that we can get really expert information to, you know, our audiences, so to the general public out there, to our patients, to everyone, in fact, at all levels of this issue. And also we're using it to share stories as well about consequences of SF medicines and how deep this issue really goes. And these stories are not better told by anyone else than those affected themselves. So that's a really great way to sort of, you know, spread the message from those affected themselves. With social media, it amplifies voice. And we are creating infographics as well, so with facts about SF medicines. And these are checked by our experts, so our academic leaders, you know, Oksana, and we're also really trying to find sources that are expertly checked and trusted. And we sort of try and make this digestible for our audience, get out the main points, and then share this on our social media platforms to raise awareness. Another interesting avenue that we've been thinking about is to perhaps use not only the Facebook platform, but any social media platform to inspire young researchers. So delivering webinars on how to conduct a literature review, research workshops, so that young people and everyone as well are well supported and have the resources to really be confident in taking that lead in conducting research, which is, you know, so important, particularly at this time. So, you know, students out there, researchers out there, my message, I think, is ask your university libraries for support on conducting research during this summer, and share this idea on your Facebook page as well. So I think that's, some ideas of how we're using social media, and Facebook as well. And, just, steal with pride and really just support us, but then also use these ideas in your own respective countries as well, because the key message is to raise awareness, and Facebook and other social media platforms are fantastic for that. Facebook is very interesting as well, because while raising awareness of fake medicines is key, and social media is brilliant, there is the fear about fake news. So it is basically about transparency, about who is advertising via the Facebook system. So Mike talks about this a lot on various occasions, and that an IP address or a domain name may not be needed here, but once you click on the ad and it goes through to a website, that will have a domain name. So again, Mike's call to action on this, and ASOP EU's call to action, which I completely agree with and wish to echo, is that domain name accountability is key. And if they can be more accountable by law, so registries or registrars being more accountable by law, that's even better. So I completely second that, Mike. And I think Mike can potentially, if we have some time, can go into the background of this particular issue and really explain it even better than I have.
That's going to be hard to top, Mariam, I have to say. Mike, anything to add on that issue? Because, it's true that there is that very straightforward way of buying things online, which is literally going to this webpage, but then we have the social media platforms linking to these. So any additional thoughts from you on this?
I think Mariam has explained it superbly. I don't really have a lot more to add, except that within the EU, and again, it's a parochial EU view, but it is 28 member states, or 27, depending on if you discount us, the UK that is. But they are about to update the E-Commerce Act, which is no longer fit for purpose. The closing date for submissions from all interested parties are September the 8th. And as Mariam has mentioned, we believe that laws to be passed to regulate who gives out domain names, and these are called the registrars, the internet service providers. And not only is the new Digital Services Act looking at websites, it's also looking at social media and e-platforms. So in our opinion, this is the biggest thing in town. It's an opportunity to have legislation which will confer liability of how these people operate. And so that's got to be a good thing. I know there are freedom of speech issues and this sort of thing, and we don't want any laws to get in the way of that. But where we have criminal activity and the, how can I say, the conveyors of this within the internet ecosystem are not being accountable, this is our real opportunity. I sit on the EU IPO, the European Intellectual Property Office, and their observatory. This provides research and information to all of the commissions within Brussels. Then we have an expert group on domain names, on platforms, on payers, and social media. And we're about to publish some of the recommendations, which will be around best practice. But for me, the most potent thing is to actually get some laws in place, because I think voluntary action by these big tech companies have only gone so far. They've done good things, but we need to get them to do more. Thank you.
Thank you, Mike, for that. And just to note that we're encouraging everybody to engage with us in this discussion on the chat box. And I know that there are some discussions going on, so please do that. And we do have a question from an audience I'd like to pick up, since we are talking about social media and digital technology and the support. And maybe just a question in general, but are there digital apps or softwares or programs to help with addressing the issue of SF medicines? And I think this is a question coming from an individual use of these apps rather than big programs and softwares for institutions. So wondering if any of our panelists can support by an answer or even sending through. Mike, would you like to start? And then if anyone else has any suggestions, you can send them through the chat.
It's very interesting that during the development of the Falsified Medicines Directive, the EDQM, which is the government body that oversees throughout all of the European Council members, actually wanted the patient to ping the pack, which had a data matrix on it. but it was regarded at the time as a bridge too far. It should be the pharmacist that's authenticating the prescription medicine. But there was a willingness to actually move it down to patients. And I think we will see in the coming years more and more responsibility put on the patient to actually authenticate the pack. And we've seen situations in sub-Saharan Africa where these things have been actually done. Each pill is serialized, but it is a fact that criminals have copied some of the systems. But yes, I think again, it goes back to which app can we trust, which has been properly approved. And I think, again, initiatives like top level domain names, .pharmacy, if you go to a website with .pharmacy, then you know that medicine is going to be correct for the jurisdiction it is being sold in. So there are just a few thoughts.
Thank you, Mike. We just being mindful of the time, we have about 15 minutes to go. So we'll go through some more questions. And again, panelists asking them to be brief and of course, continue the discussion on the chat. So a question for Flandry down the line. Flandry, I know you've been listening. Thanks for being with us again and really, really happy to have you. A quick question here from a colleague from Nigeria about how we can engage with transport and shippers to raise awareness to them about their transporting SF medicines in country. Can you tell us any thoughts or reflections from your experiences in Rwanda on this issue?
Yeah, thank you, Lina. Thank you. As different studies shows that Africa accounts 42% of global detection cases of substandard in the fake medical products. So all of these, I think it comes due to this free trade zone. African countries are establishing to be able for the fast growing of the African countries. This one is giving is giving the way for counterfeiter to supply counterfeit products in Africa. So I think the main challenges different countries are facing is the lack of equipment to detect the counterfeit products. So even where they tried to do so they face some problems of the cost. Those examination is costly, but we can't relax just waiting those products coming in our continent, as the different studies shows that many products are coming from China and they coming from India. So I think there is a need of inter collaboration between the manufacturers and the countries and the regulatory bodies. The regulatory bodies should be strengthened to be able to detect the counterfeit medicines. Every borders should be well equipped. If there is a way of supporting different countries, WHO should support the countries to be able to equip the borders of the countries to be able to detect those counterfeit products. So thank you very much. I think Mike can support me to answer this question. But in the case of Rwanda, I may say that we are doing our best to fight these fake medicines. Last year in December, the Rwanda Food and Drug Authority highlighted employee different pharmacists to go to work on the borders to be able to detect all medicines coming in Rwanda. And internally also, all pharmacists working in different areas. The Rwanda FD have established the way of reporting each product, each medicine, which is suspected, to be able to put it, to send it to the national laboratory. So I think African countries should compile also this culture of empowering their pharmacists to be able to detect all suspected products to be able to protect our population. Thank you very much.
Thank you for that, Flandry. And I know Mike does have some things to add to that. Mike, if I can ask you to be very brief and perhaps share some of the links you're about to mention to us via the chat, that I would be very grateful. But a few seconds from you to add on to that from a custom regulations point of view.
Yes, I would thoroughly recommend a quick read of at least the executive summary on the link of the OECD EU IPO report, which was launched in March. Stan and myself had input into that report, and it really does sketch out. And there's a part of it which is particularly relevant, and that's the online environment, because the online environment really is being made alive, if you like, by the increasing amount of small parcels. And when you have millions and millions of small parcels entering into a national postal system, it is really, really difficult. And I know that Stan may have a comment on this, but there are possible moves to look at how postal systems can be made more transparent. And so this is basically, I would argue, a customs initiative that will help to identify criminal parcels entering into a particular jurisdiction.
Thank you for that, Mike, really helpful. I have a quick question for Mariam, and Mariam, I think we'll do a mix of a verbal answer and sending through some information and links. That's always helpful. But one is about, is there a database of resources that contains all of the opportunities available for students to get involved or help with current projects? I think this comes from a very enthusiastic student, but maybe some guidance from you on what is available for such students would be helpful, and then sending through anything else via the links. Thank you.
Yeah, so there is a lot out there to support you. I promise you that. So yeah, I'll try and send over as many links as I can and go through a few bits just now. So first of all, there are a lot of non-profit organizations out there. There are organizations like European Federation of Pharmaceutical Industries and Associations. We have ASOP EU, we have Fight the Fakes, we have partner organizations of Fight the Fakes. Universities like King's College London have been joining us very recently. UCL, so us, we're also a very active member too. There's IFMA, and all these links to their sort of websites can be given. But if I think this was a student question, so if I reach out to the pharmacy students who are our future pharmacists on the front line, they can really benefit from. They can really add to this by raising awareness, but they can benefit themselves with some training as well, which Oksana really talks about a lot. So, at university, it's drilled into us that we are the medicines experts. So this problem directly affects us. And Oksana has been working on the education element so that pharmacists are fully trained to deal with SF medicines. So like through visual inspections or identifying tamper-proof. And so training is key here. So just look out for what's available to you as well. And Oksana can probably shed more light on this, but she's been working with sort of 5 African countries in terms of pharmacy curriculum development. So I think, ask your universities what is available, and also just, look around you to other universities, reach out, see what support is there for you as a pharmacist or a future pharmacist to really help, while you're on the front line, those practical tips of what you can do. So that's important. I think the Youth IGF movement is a brilliant station. I'm involved with it myself, together with Mike, we organize events and webinars as ambassadors across the globe. So we have ambassadors from the Philippines, Nigeria, Ukraine, Indonesia, India, everywhere. There's a lot of us, and Yulia from Together Against Crime, and of course ASOP EU, Mike, promises expert support to young ambassadors like us. So please get involved that way, or liaise with your local YIGF ambassador and see if you can do something together, see how you can support as a student or as a young person. And I think they're particularly active on Facebook. So there was the Facebook question earlier. So, that's useful there as well. There's also a central hub of sort of amazing infographics that you can sort of download. So you don't need to make them all from scratch. Fight the Fakes, ASOP EU, if you go on their websites, you can use these as starting points. They have infographics that are already there. They just need to be shared. So, most of the work has been already done, and I can't stress how important it is for students, young people, pharmacists, whoever you are, just share these as much as you can. You know, while you're on your commute home, for example, just retweet or just, you know, share an infographic, because these have been created by the organizations I've mentioned. Because, you know, creating your own organization might be less feasible for you in your situation. So it's the little things that really have a big impact as well. But if you're thinking about organizations, there's the Google AdWords grant that, you know, it's a charity that, you know, if you want to organize a charity yourself, an organization in your country, you can look at that for funding. And I think Mike and I can share some links to help you with that. UCL Fight the Fakes is a brilliant station. We are completely student-led, but expertly supported, of course, by our founder, Oksana. So I mentioned our upcoming projects earlier, so our Instagram lives, and we're looking into research projects and sort of, you know, making research into a digestible format to share with everyone and you know, the general public. And we also did some informative videos together with IPSF on how to stay safe during the pandemic, how to identify legitimate pharmacies online. So things like look out for the EU common logo and things like that. But we are, so we are looking for more and more ideas as well, and we'll be changing course on our projects as the pandemic changes courses too. So just reach out to us as well. As UCL Fight the Fates, and we can even share our experience of how we are set up and how we are, what we are doing and things like that. So you can replicate that in your respective countries, or you can partner with us, in fact, on our Instagram lives or whatever we have. So if you have any specific questions like that on, you know, organization, or you can ask Oksana always. She's always answering our questions as well.
Thank you so much, Mariam. And it's actually great that Oksana is with us. So everybody ask away to Oksana directly, following Mariam's very clear instructions. No, thank you so much, Mariam. And honestly, we can just spend hours and hours talking about this issue. Part 3 and 4, it may not be enough, but I'm very conscious of time, and I know we still have a lot of questions to go through, but we might just skip to a big roundup question that sort of maybe puts things in perspective, because we do have to end soon. So I'd like to ask everybody another same big question, a really good one that came from the audience last time. We actually got 2 questions that ask the same things. It's which countries, in your opinion, are most vulnerable to SF medicines, or what factors lead to vulnerability? At the same time, which countries have a low rate of counterfeit medicines? So it does ask the same question. I'd like 1 minute, please, from each panelist on this. And I'll start with Flandry and go around, and then we'll wrap up. Flandry, would love to hear your views on this. Flandry, you're on mute. I'm not sure if you're trying to speak. We'll come to Flandry. Oh, here you are.
Yes, please.
Go ahead, Flandry.
Yeah, thank you very much for this question for Africa. I may say that, as I said previously, just Africa counts 42% of counterfeit medicines. So there are many different ways which are establishing to be able to tackle these substandard products. So the head of states in January, from 17th to 18th January 2020, they signed the Rome Initiative, a bidding agreement to criminalize the trafficking of falsified medicines. So I think this is the beginning of the sub-Saharan Africa to be able to deal with these substandard and falsified medicines. So for us, as I said previously, in Rwanda, we are doing our best to be able to track the substandard and falsified medicines in our country. But different countries in sub-Saharan Africa, they are more vulnerable to these substandard falsified medicines due to the lack of equipment. So till now, I'm still emphasizing that if there is a way of supporting each countries to get the equipment, should be very, very interesting. So in most countries, national drugs councils are working to tackle the new challenges with Interpol. So I think each country's the regulatory bodies are encouraged to work in collaboration with Interpol to be able to track those substandard and falsified medicines. I think due to the time, I will keep posting you different answers. Thank you very much.
Thank you very much, Flandry, for sticking to time. 4 minutes, and we have 4 more responses. We're going to stick to time. A quick one, maybe Oksana. 1 minute, please, or less. Thank you.
So when we think about what makes countries vulnerable, anytime a supply chain is disrupted, so whether that's because that particular region there is conflict, if it's a war zone, we know the DRC, for instance, has been a hotspot for falsified medications, as well as access to medicines. So in countries, the US also has a high number of reports of substandard and falsified medications, despite it being in a high-income country. For instance, Avastin, there were many in 2012, I believe, cases of that infiltrating, but the FDA did actually manage to identify those cases. And so when we look at universal health coverage, access to medicines also feeds into this. Where these systems are perhaps more equitable, there is some degree, not all, because we still see that affordable medicines like paracetamol, which is cheap, can also be fake. So it has a part to play, but that's not the full picture. And I would also say that, of course, regulatory capacity, etc., a number of healthcare workforce. So in different regions of the world, we have a massive gap in health workers. I believe by 2030, there's an 18 million shortfall of healthcare professionals globally. So that adds to the gap, as well as their training and skills. So education, of course, is the area that I'm going to always promote.
Thank you very much, Oksana. Really helpful. Stan, over to you with this one.
Thank you. Okay, a few things have been said. So what I could add is, in my view, no country is immune to the risk of falsified medicines. They are just all impacted in different ways. Take Africa, anti-infectives, antibiotics, that's where the need is. You could take Europe, the US, probably more recreational drugs, opioids, hormone growth, on whatnot. But again, that could be a much longer explanation, but just to say that's where we have to differentiate between the regions, but everyone is impacted in one way or the other. Oksana said the access strategy, important indeed. A strong regulatory and pharmacovigilance system in the country, very important. Awareness, public awareness, but also political awareness about the problem that exists, because still many ignore that they have this sort of issue in their country. But I would say also on top of that, the environment in the country, political environment, the level of corruption, but the health environment as well. What are the needs for what sort of medicines versus what are the gaps, the shortage of medicine. So there are many factors. We see very different trends from one country to another, one region to another. But the one thing to remember is nobody is truly immune. Maybe not all to the same level, of course, but I haven't seen any immune country to the actual topic of falsified medicines.
Thank you, Stan. No country is immune is indeed a good summary. Mike, over to you, and 1 minute.
30 seconds.
Yes,
I agree
you
with
so
Stan.
much.
All countries are vulnerable. We've seen the online environment shift upwards due to COVID-19. Everybody's locked down at home, buying more. We need to fix the top of the internet. So that's the guys that allow access to the internet. And once the horse is bolted, which of course a lot of horses will keep bolting, then people need to know to go to a safe haven like a .pharmacy, completely verified website, and there you will get authentic medicines. Thank you.
Thank you, Mike. Really, really good reminder. And last but not least, Mariam.
So just to echo what everyone said, is just as much as a developed country problem as it is a developing country problem. SF medicines will seek entry when global health systems are vulnerable, and we're in a vulnerable situation with the pandemic, and criminals exploit the desperation of the public, and kind of, you know, this fuels SF, you know, the SF medicine surge. So yeah, I would say, yeah, exactly what everyone said. No one is immune, no country is immune. We're impacted in different ways. And, you know, in wherever you are, whatever capacity you have, I think just take an action is all I would like to end with.
Thank you. And with that, we are on time. And I'd like to thank again all of my panelists. Really, really a pleasure to have you again. Thank you for your time. Thanks to everybody from all around the world for tuning in, and for those listening afterwards to this recording, which will be made available following today. Thanks once again, and hope you all have a wonderful day. Thank you. Bye for now.
Thank you. Bye-bye.
So much. Thank you for joining.
Bye.